Today I'm going to talk about golfer's elbow and two things that I often recommend that you likely haven't tried. Golfer's elbow, or medial epicondylosis, is technically a tendon problem affecting the muscles that flex the wrist as they attach to the medial epicondyle, which is the bony part of the inside of the elbow. These injuries occur typically when the tendon is overloaded and trauma causes a micro tearing to the tendon. This typically happens when someone is golfing and they're ramping up their golf game, or with someone that likes to hit the ground more than they should. Also, other activities that overuse the same muscle and tendon can cause the same injury. When people develop golfer's elbow, typically what we recommend is just conservative treatment with rest, ice, anti-inflammatory medications, over-the-counter medications. If symptoms continue to persist, then we recommend physical therapy, which often focuses on eccentric training of the wrist flexor muscles. Now, at this point, if someone has gone through these steps and they're still struggling, this is typically where another doctor may recommend a steroid injection into the tendon. I personally wouldn't recommend that. Like I talk about in this video about tennis elbow, I highly recommend against using steroid injections. I wouldn't use a steroid injection on myself if avoidable, unless they were maybe anabolic. Not really. Here comes our first recommendation that you may not have tried. It's called Photobio modulation, also called low-level light therapy, also called red light therapy. This video talks about the top 3 benefits of red light therapy. This recent review showed beneficial results when red light therapy was combined with exercise compared to exercise alone. The brand we like, Lightstim, makes some nice handheld devices you can use in the comfort of your own home. Now for the second recommendation that you may not have tried is an injection of something called platelet-rich plasma. Unlike injecting steroid, which only provides temporary benefit and potentially some harm to the tendon, platelet-rich plasma can help stimulate the recovery process of the tendon. This treatment can help you get back to golfing without pain. Here's a video that discusses the basics of platelet-rich plasma. I typically would recommend platelet-rich plasma after already completing 3 months of conservative treatment. For optimal results, the platelet-rich plasma procedure must be combined with an appropriate rehab protocol. Ultimately, we want you back playing golf, and you want to be back playing golf, so don't give up. Until next time.